You are watching McLaren Port here on Today's Health, and I'm speaking with vascular surgeon Dr. Joseph Cuppari about treatment options for carotid artery disease. Dr. Cuppari, why is carotid artery disease so important to be treated?
Carotid artery disease accounts for roughly 20 to 30% of strokes in patients. So we want to treat these patients when they get to a certain disease process or narrowing in their arteries to prevent stroke in the future.
And what are the treatment options?
So first, as in any medical disease process, always lifestyle changes would be first, then medications, and then unfortunately, if we have to get to a point where we do surgical procedures, then surgery.
And what are those surgical procedures?
So we typically, when you're treating carotid artery disease, there's two approaches. One is an open approach, and the other is stenting. When we stent, we can do either from the groin, which is called a transfemoral artery approach, or directly through the neck, which is a Tcar, or transcarotid artery revascularization.
So let's start with the overview of the open procedure, the carotid endarterectomy. Can you explain to us what that is?
Yeah, for sure. So carotid endarterectomy is traditionally the treatment of choice for several years now, and it's an open procedure. I think we have a video we can take a look at. So this is a patient's neck. We're going to show the vessels. There's the carotid artery as it branches into the external and internal carotid arteries. This is demonstrating what happens if there is a stroke with decreased blood flow. But with a carotid endarterectomy, if you could pause it right here, you have an incision that is in the anterior surface of the neck, just in front of the muscle, and we dissect down and get control of the carotid artery and all its branches. Once we have that control, we will open up the artery itself and with a scalpel, and we will clean out all that plaque. Once we clean the plaque out and it's nice and clean, we will put a patch over it to increase the blood flow that goes through that area. All right.
And so what is the recovery time for this type procedure?
So usually when we do a carotid endarterectomy, patient will come in the morning or so. I like to do surgery in the morning, but not necessarily have to be in the morning. But the procedure will be done. They will spend the night in the hospital. Usually that's to make sure they don't have any neurologic issues after the carotid surgery. And then typically they're home within 24 or 48 hours. After that, healing process is roughly 4 to 6 weeks where everything will be completely healed. Most patients will feel good and back to normal roughly about 1 to 2 weeks.
The next procedure you talked about, the transfemoral approach, can you explain what that is?
Yes, so the transfemoral stenting procedure is where we access into the groin and we take a wire and catheters up through all the vessels that lead up to the neck and then get into the carotid artery from that. With this video, it's going to show when we do put our wires in, we have to traverse all these different vessels, which also can be diseased. To get up into the carotid artery, we get our wire across and then our sheath across and then place our filter. And the filter is there to prevent anything from knocking off, causing a big stroke. So once, as you can see in that video, one of the issues with transfemoral is that when you're traversing all those areas with the wire as well as your sheath, you're knocking off, or potentially can be knocking off, little pieces of plaque. Those pieces of plaque can then go to the brain or a small artery in the brain, either side, and cause a stroke before we even treat the lesion. Once we get into this point, then everything should get stuck into the filter. I say this because that leads us into what a Tcar is, and we don't have to traverse any of those vessels in order to do the Tcar.
So let's, I think we have some more footage where you can show what the Tcar procedure is.
So with a Tcar, or transcarotid artery revascularization, what we utilize here is we utilize reversal of blood flow. So as you can see in this video, this is already after we have accessed directly through the neck. And then once we get through the neck, we place this sheath which will do a reversal of blood flow. And the way that that happens is we also have a sheath in the groin. And then once we clamp that artery, the blood then will, instead of going up to the brain, it comes from the brain down through this sheath into a filter, which I do have a filter with us today. And all those particles then will be stuck in this filter. So as you can see here, this is our neuroprotection device. This goes on the outside of the body like this, and this hooks into that sheath that we showed on the video, and then this one hooks into the groin. So as that blood, once we clamp the artery, the blood will come through here and will go through, I don't know if they can see this, but it has a filter inside, and all those particles will get stuck in that filter, preventing a stroke. Once we're done doing the procedure, then we will unclamp and allow blood flow to go back up to the brain. But hopefully by that time there's nothing, no wires, and the stent is already done. So there's less risk of a stroke at that point.
So what would the recovery look like for these two procedures, the femoral and the Tcar?
So when you compare them to the open, right, so the open has a bigger incision, so obviously it's going to take longer for it to heal. The transfemoral is a little needle stick in the groin. So healing process from that would be no different than heart catheterization, which can be within a week. Usually you're back to normal. With the Tcar, we have a smaller incision in the neck, so that still needs to heal. But usually these people are staying in the hospital roughly 24 hours or less, and then after that, about a week or so, they feel back to normal. I usually, on the safe side, will tell people to take it easy for 2 weeks, because usually after these procedures they feel pretty good and they have a tendency to overdo it. So I give them 2 weeks, but technically they could be back to normal in 1 week.
Do patients really feel a big difference after having these procedures done?
It depends on who you ask. I had a trainer who used to tell his patients that afterwards you're going to feel a lot smarter. I don't know how true that is, but some people would come in and say, I feel like I'm more with it. I'm catching things a little better. They feel like their cognitive ability is better. Usually, though, most people don't really feel a difference. We're not doing it to make you feel better. We're doing it to prevent you from having a stroke.
Right. We have some before and after pictures I think would really kind of
cement the point.
Yes.
So we have, I think I have 4 pictures here where we have before and afters. So these are some of the Tcars that I've done. As you can see here, the narrowing in the vessel. This is the internal carotid artery. So this is the most important one that's going to lead blood to the brain. So as you can see, we have areas here, it almost looks like a shark bite. So this is all plaque. That is filling the rest of that lumen, and then afterwards you can see this is after the balloon and stent have already been put in, so the blood flow now is going up really brisk. Next one. So I like this one. These are just different images of the same problem, but as you can see, there's very little blood flow going through that area. We would say that is a subtotal occlusion, about 95 to 99% narrowing. So that is very high risk for stroke. More than likely, this person potentially had a stroke before. So as you can see afterwards, it's nice and wide open, and the blood flow is going through. And we have a couple more, I think. Yeah, this is one of my favorites. So as you can see, once again, that big chunk of plaque right here, and then after, no more. It's wide open. And then the last one, similar type of image where we have this narrowing going through here. As you can tell, I mean, the image really does it justice. If this is that ratty, that plaque that's in there, if it gets knocked off, I mean, that's why you have such high risk for stroke. With the stents, the reason why these work so well is that it's taking all that plaque. It's not removing plaque like the open, but it is smashing that plaque against the wall, preventing it from getting dislodged and going up to the brain.
Very good. So it's really between the outside wall of the stent and the vessel.
Correct.
Very good. This has been really great information for our audience. Do you have any closing comments or anything else that you'd like to share?
Well, just that we hopefully we got across the importance of carotid disease as well as stroke, and if you have family history or if you're concerned about carotid disease or stroke in the past or in your future, then you need to talk to your family doc. I think having a good relationship with the primary care physicians does help most people figure out which avenue to go to and go through.
Great. Thanks so much for joining us today.
Thank you.
And thank you for watching this episode of McLaren Port Huron Today's Health. If you would like more information or to schedule an appointment, go to our website at www.mclaren.org/PH vascular. If you would like to watch other videos, be sure to visit our video library at mclaren.org/PH video. Thank you for watching. This is Kelly DiNardo from McLaren Port Huron Today's Health.